Honourable Members, I have received correspondence from the member for Arnhem as follows. I propose for discussion this day the following definite matter of public importance: that the Northern Territory Government ensures its investment in healthcare meets current and projected future needs of all Territorians. The letter is signed by the member for Arnhem. Is discussion supported? 4 members must stand. Yes, it's supported. I call the member for Daly.
Thank you, Madam Speaker, for giving me the opportunity to speak tonight on this matter of public importance. Madam Speaker, Territorians deserve access to high quality and safe health care, no matter where they live. As with all services here in the Territory, delivering health care comes with an enormous built-in challenges. It is hardly a secret that this is due to our small but scattered population, our remoteness, and our chronic health issues that afflict a large part of our community, a direct result of poverty and disadvantage. None of this is new, but each year it does mean the demand on our health system continues to grow. The NT also has the highest rates of kidney disease and the fastest ageing population in the country. This exacerbates existing demand in the system, particularly when it comes to treating chronic conditions. The demand for mental health services continues to increase as more people seek treatment for conditions they may have dealt with silently in the past. Madam Speaker, despite the obvious and growing demand for healthcare right across the Territory, it is incredibly concerning to hear the rhetoric from the CLP government that they think additional investment into healthcare sector to address need is a blowout. It is incredibly concerning because it suggests that the government is warming up to slash healthcare funding in the upcoming budget. All the signs are there, Madam Speaker. We have fought forward with this matter of public importance this afternoon to urge the government in the strongest terms possible that cuts to the health budget are effectively cuts to the health and well-being of Territorians. We have seen the CLP government take some very simplistic approaches to the very complex challenges that we face here in the Territory. We have seen them cut Territorians out of the conversation and barrel on with a range of changes that make the Territory worse off, not better off. So, Madam Speaker, we believe our concerns about what they intend to do when it comes to the health budget are warranted. Madam Speaker, all we have to rely on here is their track record track record so far on other matters, because we have heard the Minister for Health say precisely zero about healthcare. The odd press release here and there about a single initiative, the removal of flags from hospitals. That's all we've heard about. He has offered no vision, no direction, no plan when it comes to how his government intends to ensure Territorians have access to quality health care that meets their needs now and into the future. This is despite it being one of the key issues for Territorians. This is why we are putting it firmly on the agenda. We know how important it is to Territorians. That's why the former Territory Labor government invested in healthcare. It is why there was strong investment in new healthcare facilities, in more healthcare workers, in the upskilling of our incredible doctors and nurses. Like all systems around the world, Madam Speaker, the Territory Health Service continues to face enormous demand pressures, complicated by rising costs, recruitment challenges and ever-changing demographics. While in government, Labor didn't invest blindly in the health system. We did it in a considered, evidence-based, strategic way. This approach led to the creation of NT Health under the Health Service Act in 2021, a single integrated entity responsible for the delivery of health services across 5 service delivery regions: the Top End, East Arnhem, Big Rivers, Barkly and Central Australia. This strategic approach allows our health services to work together in a unified way with resources allocated where they are needed most, on the front line. It also allows NT Health to work in greater partnership with families, their community, Aboriginal health organisations and stakeholders to deliver better health outcomes. This is because Territory Labor take the health needs of Territorians seriously and delivers on priorities. The current government, however, has failed to outline their big picture plans for the Territory Health Service since coming to government. Health barely even rates a mention from this government. Territorians deserve better than this. They deserve to know how this government intends to invest in and deliver health care. More than 6 months in, there are just no answers so far. It barely rated a mention in the policy they took to the election, but we do know they had a plan at some point to decentralise NT Health into top-end health and Central Australian health. Then the Leader of the Opposition mentioned this in passing in a budget reply speech. That policy obviously sunk like a lead balloon because we hadn't heard anything about it since. I know the entire health sector could be keen to know whether the CLP intends to deliver on this or not, given the significant impact it will have on service delivery. So it would be good if the Health Minister can confirm this one way or another, rather than pretending he didn't hear his Chief Minister say it. But we know that this government is skittish when it comes to being transparent with Territorians. They are more interested in public relations management rather than actually managing the Territory. Madam Speaker, as I said earlier, and in stark contrast to the former Territory Labor government, the CLP are yet to deliver on a firm and concrete health agenda. There is no plan to growth to meet the increasing demand for services. There is also no planning to deliver major health infrastructure projects. Across the Territory, NT Health has 7,300 dedicated health workers who are critical to providing safe and responsive patient-centred care. Surely it's time the government filled them in on their plans. Madam Speaker, we know this may be difficult for the Health Minister given his track record on engaging with health staff so far. Last year, he pulled out of speaking at the Rural Medicine Australian Conference because he didn't want to face potential criticism from health professionals about the CLP lowering the age of criminal responsibility. This is a highly prestigious conference organised by the Australian College of Rural and Remote Medicine and the Rural Doctors Association of Australia, and attended by around 1,000 doctors and health professionals from across the country. He was due to speak, but pulled out at the last minute. He told media he had a clash with another event, apparently. Very believable. It's such a shame, as it would have been a good opportunity for him to outline the government's plan for healthcare, but he squandered it. But then, accountability is not one of the government's strong points, or the ministers, which is why we remain concerned about this government's plan for health. It would be a huge relief for Territorians and for health workers if the Health Minister could confirm there will be no cuts to any of the Territory's public health services. That's why we're calling on those opposite to ensure that funding to our health services remains funded to meet those needs into the future. The former Labor government invested record funding of over $2 billion a year into the health system in the last 2 years, ensuring funding for the full spectrum of primary health, public health, community care and acute hospital services. The former government also worked hard with our Commonwealth partners to address funding inequalities, and we're excited to see Territorians benefit from the many recent Commonwealth announcements surrounding health funding in the Territory. Those opposite will parrot their usual lines about reckless spending, but there is nothing reckless about ensuring that the Territory health system is meeting the needs of Territorians who access these health services. Madam Speaker, we know this CLP government is like a teenager on P-plates, all false bravado and no real-world experience. But it is time they knuckled down and got on with the hard work of government. It takes a bit more than finger-pointing and introducing overly simplistic laws that don't follow the evidence and do more harm than good. But the CLP government think they are short-term political winners for them. But ensuring that healthcare is appropriately funded to meet demand is not a hard decision. It's necessary, Madam Speaker. That includes investing in quality health infrastructure. The former Territory Labor government left a strong health infrastructure legacy to meet future demand, and we urge the CLP government to get on with delivering on this. This includes $22.9 million for a new 32-bed modular multi-purpose facility at Royal Darwin Hospital, $1.3 billion for the construction of staff accommodation at the Tennant Creek Hospital, $22.6 million for upgrades to the forensic pathology facilities at Royal Darwin Hospital, $25.1 million for mental health inpatient unit expansion at Royal Darwin Hospital, which is jointly funded by the Northern Territory and Australian governments, $32.2 million to upgrade central sterilisation services across Territory hospitals, $20 million to construct a new health centre and morgue in 𝘫𝘓𝘳, $26.9 million to construct a new evolutionary care centre at the Alice Springs Hospital, $6.6 million to develop a hybrid operating theatre at Alice Springs Hospital, $20 million for fire safety system works at Gove District Hospital. It also included the new funding of the $20 million to construct a new primary health care centre in Borroloola to improve primary care delivery across the Roper Gulf region and deliver care closer to home. $12 million to prepare for the new 120-bed residential aged care facility at Palmerston Regional Health Precinct. This is on top of Territory Labor's strong legacy on health infrastructure delivery, improving health outcomes for Territorians across our cities, towns, regions and remote communities. This includes delivering the Palmerston Hospital, something the CLP couldn't do. Upgrading the Gove District Hospital Emergency Department, delivering a new intensive care unit, renal ward and heart and cancer clinic upgrades at the Alice Springs Hospital. Delivering a new ambulance station in Katherine, delivering a PET scanner at Royal Darwin Hospital, delivering infrastructure upgrades to remote clinics including 𝘫𝘦𝘬𝘕, 𝘓𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬 such as these provide Territorians with better access to effective and affordable health services, including services closer at home. Territory Labor also made pathways towards more community control in the delivery of health services, because we know that involving communities in their own healthcare decision making greatly improves health outcomes. The former Labor government oversaw the transition to community control of Me Watch Health in East Arnhem Land, Red Lily and Malala Health Services in West Arnhem and the Central Australian Aboriginal Congress. Communities delivering culturally appropriate services and for their own people. It should always be a key goal of any government if they are serious about improving health outcomes for Territorians. Madam Speaker, recognising and enabling Aboriginal leadership and local decision-making processes is only one step towards improving health outcomes in our remote communities. It needs to be backed up with the right investment and the right resources. Territory Labor government worked to ensure all of these elements were working together to bring about high-quality health services that address the unique health pressures of the Territory in a sustainable way. We were serious about funding healthcare for Territorians and funding it well. We are yet to see from this CLP government what they will fund. Madam Speaker, I would like to acknowledge the NT workers who have our endless praise and support. They do incredible work every day in our hospitals, our clinics, and in our community, often under difficult and demanding circumstances. We know the health workforce shortages are a reality right across the country and indeed globally. Addressing shortages here in such a competitive environment requires forethought, planning and innovative thinking. Getting healthcare right isn't about isn't just about investment, it is also about ensuring our incredible, valuable healthcare staff had good paying conditions, that we are growing our local workforce and that we are attracting more skilled health staff here. The recently announced designated area migration agreement signed off by the federal Labor government has been described as the best deal in the country and provides twice as many places than the previous agreement. It includes a number of healthcare related occupations and will make a big difference to our capacity to bring in more skilled workers. Madam Speaker, speaking of the Territory Labor Government, it has been exciting to see the recent health announcements from the Albanese Labor Government over recent months. That includes the recent announcements that 9 out of 10 visits to the GP will be bulk billed. This will deliver significant cost of living relief to Territorians. We've had the federal member for Solomon, Luke Gosling, recently pledge a new Medicare urgent care clinic to open right here in Darwin. Like the current Palmerston Urgent Care Clinic, this will be a game changer for our health services here in the Territory. The Palmerston Urgent Care Clinic, which opened in 2023, has already seen 20,000 presentations so far. This new urgent care clinic will provide Darwin residents with an alternative option when seeking medical attention, while also helping reduce pressure on our emergency rooms across Darwin and Palmerston. Best of all, Madam Speaker, visits are bulk billed. Madam Speaker, the Albanese government also announced a $51 million boost to hospitals here in the Territory, helping to ease the burden on services, ensuring better care and reduced wait times for patients. Territory Labor is excited to see these announcements from the federal government, and it shows the importance of putting Australians and Territorians' health at the centre of service delivery, because our health impacts every aspect of our life. Our ability to participate in the economy, our social life and the Territory lifestyle all rely on being able to access effective, reliable and efficient health services when we need them. Madam Speaker, investment in healthcare is not just about dollars and cents. It's about Territorians. It's about ensuring that every Territorian, no matter where they live, have access to the healthcare they deserve. Madam Speaker, we urge the government to do the right thing and continue to invest in the health of Territorians in this year's budget. Thank you, Madam Speaker.
Minister for Health.
Thank you, Madam Speaker, and I rise to speak in regard to this MPI, that the NTG ensures its investment in healthcare meets current and projected future needs of all Territorians. I thank you to the member for Daly for raising some of these issues, and I'll get to some of those points that he raised as I work through my speech. But it is important to remember Labor's performance over the last 8 years trying to manage the health system. And I've only got to go back to my electorate, Madam Speaker, in Christmas 2021. Labor was out there as my electorate was approaching Christmas in 2021, Madam Speaker. Labor was out there closing health clinics in my electorate. It was absolutely devastating for people living out bush. They closed the Canteen Creek Health Clinic, closed the Epinara Clinic, closed a number of clinics that year in Central Australia, and it was absolutely devastating for people living in the bush. And this is just an example of the way that Labor over 8 years were treating people living in the bush. It was absolutely devastating. I had call after call after call. Labor, no interest at all. Showed no interest at all in health out bush, just closed the clinics, walked away and left it at that. So that's just one example, and I'm sure I'll get to many more as I speak tonight about this. So, Madam Speaker, the CLP remains dedicated to breaking the healthcare challenges cycle and attracting and keeping staff here, ensuring timely, reliable care for all Territorians through reforms and targeted investments. Firstly, it's imperative to understand that the recent history of neglect and failure from Labor with regards to delivering and ensuring its investment in healthcare to meet current and projected future needs for all Territorians. Madam Speaker, I've just given one example, but under Labor's reign over the past 8 years, we have seen a complete failure to invest in ageing infrastructure and health. Labor has overspent the health budget every financial year since 2016-17, including an almost $280 million budget blowout in 23-24. I've previously spoken about the 𝘫𝘶𝘰𝘳𝘵𝘱𝘵 computer system blowout of $61 million from $259 million to $320 million. Who would forget, and I'm sure the member for Nelson will remember this, the decision to spend $5,000 to hire a Christmas tree. Yeah, that's the sort of attitude from the Labor government when it comes to delivering health services here in the Northern Territory. NT Health violated government procurement policies when it awarded a controversial $700,000 consultancy contract to Ernst & Young without going through a public tender process. The Auditor General findings, which included how the contract ballooned to more than $4.3 million after multiple variations were reported in the NT Independent on the 14th of December 2021. Madam Speaker, $27 million was spent on overtime hours in health across the Territory for the financial year to March 30, 2023. And this is an important one. Back in July 2018, Madam Speaker, the former Labor government promised to build a $5 million Bradag facility in Tennant Creek, and Bradag is delivers alcohol treatment, education and rehabilitation services in Tennant Creek. So $5 million was promised for Tennant Creek back in July 2018. In fact, it was the 4th of July 2018, and in fact, I've got the media release here in front of me. This is what they said. There was a Minister for Health back then, one of their chief ministers, Natasha Files. I think they had 3 chief ministers, Madam Speaker. But in any case, back in the 4th of July 2018, they promised, announced that a purpose-built resident rehabilitation transitional outreach accommodation facility will be constructed for the Barkly Regional Alcohol and Drug Abuse Advisory Group, which is Bradag. But I think one of the other parts that's often forgotten, Madam Speaker, is that what they did say is that by building that facility, it would free up 19 Territory housing properties that would become available to people living in Tennant Creek. Now, of course, not one shovel has hit the ground, and when it comes to health, we know that better housing will lead to better health outcomes. So 19 houses were never delivered back to the people in Tennant Creek because of Labor's failure to invest in alcohol treatment and rehabilitation facilities in Tennant Creek. But it wasn't just that. In Tennant Creek, they also promised in 2020 to build 12 one-bedroom units for health staff so that we could attract and retain health staff in Tennant Creek. Again, Madam Speaker, not one shovel has hit the ground. So I think everybody in this House should be starting to get a bit of a picture now on the way that the former Labor government delivered health services or failed to deliver health services right across the Northern Territory. When Labor lost government, they left 80 patients waiting for residential aged care. The knock-on effect has meant that bed block in our hospitals, which is a significant cost compared with residential care. The then Health Minister, Madam Speaker, the current opposition leader, Selena Uibo, and her colleague, the previous Health Minister, Natasha Files, I don't know how many times waffled on in Parliament but provided no solutions to fix the broken health system. The Territory's healthcare system has been in crisis due to numerous failures of the former tired Labor government, such as surgery wait times blowing out to the worst in the nation. Well, you know, how many times can I talk about this failed 𝘫𝘶𝘰𝘳𝘵 IT rollout, and most significantly, the failure to act on the assaults on our frontline workers working in our hospital system and also working in the health system out bush. Absolutely disgraceful. The fact that the government previously spent millions of dollars on security in our hospitals and clinics just shows how bad the situation has been right across the Northern Territory. Madam Speaker, Labor spent $13.3 million on security and health across the NT, which has increased from $10 million. Of this, $7.1 million was budgeted for the Dheran region, but actually cost $8.1 million. another security cost blowout, but even worse in Central Australia, blowing out from a budgeted $1.6 million to $3.95 million. Of the Central Australia funding, $1.4 million of this was spent in 2 remote communities, being 𝘫𝘭𝘢 and 𝘫𝘠𝑚𝑢. Madam Speaker, Labor's lack of action to address alcohol-fuelled violence and antisocial behaviour not only created unsafe environments for staff and our patients at our hospitals, but made it extremely difficult to attract skilled professionals to the Northern Territory. In 2024, a total of 494 assault incidents were reported by frontline staff at NT public hospitals and health facilities around the Northern Territory. When the Territory is not safe, Madam Speaker, when it's not safe to live and work, this leads to critical shortages in personnel, including our health staff. That's the situation we face when they're not safe at work, when we have high crime rates right across the Northern Territory. This is what harms our ability to attract health staff to the Northern Territory. Let me remind the House of the significant issues surrounding the Health Department's troubled Acacia patient health record system. If the Leader of the Opposition recalls, she was both the Minister for Health, the Minister for Corporate and Digital Development when the decision to pause the rollout of Acacia into the Royal Darwin Emergency Department was taken due to risks to patient safety. In her cabinet role, she was directly responsible for the Acacia system, both from a health and IT perspective. It emerged that the budget for the Acacia project blew out by $61 million from $259 million to $320 million. To this day, the Acacia system is still not being used at the Royal Darwin or Palmerston Hospital emergency departments while the system is enhanced. Despite lives being on the line, Labor did very little to sort out the issue in the 8 months prior to being turfed out of government. In fact, all Labor did was leave us with a $280 million overspend in the health budget. This is yet another health mess the CLP government is cleaning up from the previous Labor government. I'd like to cast your mind back to December 2020. At the time, we heard some hollow lines from, again, one of their chief ministers, this time Michael Gunner, I think, talking about departments tightening their belts and living within their means. The next business day, we learned that Labor had spent $5,000 renting a Christmas tree. After being asked asking everyone to tighten their belts, the next day $5,000 is spent on a Christmas tree. I wasn't surprised, just disappointed. In January 2024, we pointed out that since 2016, the median wait time for Territorians choosing to undergo a medical procedure in the Northern Territory had increased by 54%, resulting in an average wait time of 316 days. Median wait times for non-urgent elective surgeries at Royal Darwin Hospital were up 113%, or 403 days. Palmerston Regional Hospital was up 32%, or 386 days. Gove Hospital was up 42%, or 327 days. Katherine Hospital, there's no procedures there. Alice Springs Hospital was up 51%, or a wait time of 148 days. After a damaging 8 years in government, Labor allowed a distressing progression of worsening circumstances. The level of non-urgent elective surgeries conducted in the Territory plummeted by a staggering 37%. In stark contrast, the number of individuals undergoing non-urgent elective surgeries in Australia's public hospitals has increased by 81.6% during the same period. To counter the loss of nearly 600 full-time positions from Territory Health, the CLP has taken back control of our streets, is rebuilding the Territory's reputation and getting our economy moving forward. Rampant community safety issues deter healthcare professionals from working in the Territory, exacerbated by frequent assaults on hospital staff. I mentioned earlier that when Labor lost government, they left 80 patients waiting for residential aged care. This has meant bed block in our hospitals, which is a significant cost compared with residential care. Put simply, a shortage of residential aged care facility beds is contributing to aged care-related discharge delays, placing increased pressure on NT hospitals. The fact is, under Labor, the NT has the highest aged care occupancy rate, being 92.2%, and longest hospital stays for older patients awaiting aged care placement. In addition, the NT has fewer residential aged care beds per capita, 47.5 beds per 1,000 people over 70, compared to the national average of 67.5 beds. Since coming into government, the Country Liberal Party has lobbied with the federal government to secure $120 million through the Commonwealth Aged Care Capital Assistance Program for a new 120-bed residential aged care facility in the Greater Darwin region. As recently as last Friday, the Minister for Aged Care, Federal Minister for Aged Care, I should say, announced that the department would open expressions of interest process to build and run an aged care facility in Palmerston. So the work that we have been doing with the federal government, lobbying them for $120 million, it feels like it's starting to pay off, but let's wait until we see the federal budget. The NT Health has been working closely with senior Commonwealth officials to attract interest from registered aged care providers to build more residential aged care facilities here in the Northern Territory. The NT Government has allocated land adjacent to the Palmerston Regional Hospital for a residential aged care facility which an aged care provider could build on. The site is ideally located for co-delivery of care for residents of a future facility. So what else have we delivered since coming into power? For a start, the CLP government is delivering better access to the Royal Darwin Hospital with planned upgrades to improve safety and to relieve traffic congestion. The upgrades, which will be delivered in 3 stages, include a redesign to the current Rocklands Drive and Florey Avenue intersection, temporary access of 𝘫𝘦𝘬𝘪𝘵𝘬𝘪𝘐 Drive and Burnett Road for emergency access only, and a second permanent entry to Royal Darwin Hospital will also ensure access to the hospital is always maintained for emergency services. These upgrades were well overdue and have been brought forward as a priority. Appropriate access to RDH is a key driver to improving community livability, and these much-needed upgrades will deliver better health outcomes for Territorians while strengthening the resilience of our emergency and hospital services. The former Labor government continued to put Territorians at real risk by dragging their feet and not delivering these works. Astonishingly, they prioritised an MBL high-performance centre and other Labor pet projects over Territorians' health. The NT Health Capital Works program includes NT government-funded projects for health centres and morgues in both 𝘬𝘬𝘬𝘬𝘬 and 𝘫𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝑛. The real question is whether they have actually been funded under the budget set by the former Labor government. 𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬𝘬 Healthcare and Morgue and 𝘫𝘬𝘬𝘬𝘬𝘬 Health Centre and Morgue design is well progressed, with finalisation subject to current development application processes. The 𝘓𝘓𝘓𝘬𝘓 Health Clinic was completed in August, with Aboriginal community-controlled health organisation Red Lily Health Board commencing operations in the new 𝘓𝘓𝘓 Health Centre on the 2nd of September 2024. Madam Speaker, Territorians deserve better, and these works are proof that we're getting on with the job and prioritising infrastructure projects that will actually improve the lives of Territorians. The Australian and Northern Territory government's joint-funded 48-chair ambulatory care renal dialysis building in Alice Springs is waiting the outcome of a development consent application. A new four-chair nurse-assisted renal facility in 𝘥𝘬𝘬𝘬𝘬 construction tender was recently declined as responses were cost prohibitive. The project is now being considered as part of the broader planning for remote renal facilities to ensure value for Territory construction outcomes. Madam Speaker, Purple House has benefited from the Commonwealth investment in infrastructure to bring dialysis units into remote centres. The Better Renal Services measure will provide $73.2 million to fund up to 30 chair dialysis units, including workforce accommodation where required, to provide dialysis on country to First Nations Australians with end-stage kidney disease. Having renal facilities located within remote communities ensures Territorians with kidney disease can access appropriate treatment on country, reducing the reliance on services in town and dependencies on patient travel, visitor accommodation and relatives in public housing. Labor made the announcement about how they were investing in our future and delivering greater health services across the Territory in their budget 2023, but progress in health-related infrastructure has been slow. You've only got to go back to a federal Labor announcement on the 26th of April 2022, where they promised 500 new First Nations medical trainees. Federal Labor promised 30 new renal clinics on the 22nd of April 2022. They said they would double the funding for rheumatic heart disease. Where is this money that they promised? Here we are going into another federal election, and all we're hearing is all these vague promises again by Labor. I wouldn't trust Labor with $50 to go shopping for my grandmother, Madam Speaker. I wouldn't trust them with $50 to buy anything for my grandmother, and here they are on the eve of another federal election making unfounded promises again. They haven't even delivered from the last election, and here they are out making further promises. Madam Speaker, work is underway at Royal Darwin for the new 24-bed mental health facility and also the 32-bed ward at Royal Darwin Hospital. The CLP government is undertaking a comprehensive review of patient travel and logistics, both road ambulance and aeromedical services, which will set a new strategic operating model for these services. The review is focused on streamlined and improved command centre arrangements, achieving operational efficiencies and expanded use of digitally enabled remote care where applicable. Several key service contracts are scheduled for renewal by early 2026, and this review will inform contract renewal processes. In addition, work is in progress to expand the Northern Territory Health Hub for remote charter travel for NT government agencies to achieve greater efficiency in the use of scheduled remote charter flights. Madam Speaker, the CLP has made and delivered on our commitments to enhance the NT Pharmacy Scope of Practice program, similar to the current model operating in Queensland. James Cook University is currently admitting NT students into the required training program with 13 enrolments to date. Earliest completion date for this student cohort is December. NT Health delivered the urinary tract infection program on the 28th of October 2024. Pharmacies in the Northern Territory are now delivering this service, and around 1 to 2 pharmacist-led treatments occur every day. 13 pharmacists have enrolled in a relevant course to undertake the necessary training to deliver full scope of practice activities and are eligible for a subsidy of $8,500. Madam Speaker, can I get an extension?
No.
No? And just in closing, Madam Speaker, the CLP is delivering on our health agenda.
Thank you. Member for Mulca.
Thank you, Madam Speaker. I thank the Leader for the Opposition for bringing this MPI tonight. I want to talk about homelands tonight for 2 reasons. I want to talk about homelands tonight. Firstly, proper investigation or investment in our homelands will significantly contribute to people leading healthier life. Homelands are our ancestral country, so we can hunt on these lands and be looked after by country. This is much better than living in big communities where we are living on someone else's country and cannot hunt. And it's better than living in urban environments. Madam Speaker, in both these places, people are often eat away on and not choosing a healthier lifestyle. They don't want to hunt for, don't go to hunt and fish and collect maypole, which is oysters, so they don't exercise. Many people living in permanently in homeland communities. We have been healthier centers and visiting medical staff. We have schools. These are functional small towns that require new houses and housing that the overcrowding is dealt with. The family members of have been forced into bigger community towns can come back into country. Madam Speaker, I want to point out the investment in homeland towns will help across a number of areas: mental, physical, and spiritual health, strong two-ways education, positive pathways for our young people that do not connect with crime, and there is a capacity to build small businesses and industry becomes, and because we are the landowners of the resources and owners. This gives us the opportunity for economic independence and businesses growth. In many ways, investment in homelands today will benefit both the government and the people in the future, and it will have a significant positive impact on the health of Aboriginal people, which will contribute to closing the gap for Aboriginal people. Madam Speaker, as I said, there are already many people living on country in homelands, and while many of these homeland centers have medical centers and visiting medical staff, there are big concerns about emergency patient retrieval from homelands in the region. I have raised this many times with the former Labor government and was always promised that something was happening. In 2018, I was advised that there was a review of the emergency patient retrieval department of health with 131 recommendations. The department promised to keep my office updated on how these recommendations would be met, but nothing followed. Another has changed. We still see significant issues of emergency patient retrievals. In estimates and through written questions, I have asked for the emergency retrieval and patient retrieval processes for homelands, but the response I am given never matched happening on the ground. I am told St. John ambulance will go to 100 kilometres from Nhulunbuy, but that only covers the cost and to the close homeland. And after the ambulance will not be dispatched to, in case there is an emergency closer to town, or already be tied up with patients or being taken to meet care flights at the airport. After 100 Ks, I am told that the care flight planes will be dispatched, but even in this situation, the care flight plane is a twin-engine plane that can land on most homeland landing strips. Often, homeland residents are left waiting while medical help comes on a chartered plane and a homeland worker and medication rather than the a paramedic. While I understand that there have been cases of a helicopter based on in the region prepared, there has been no outcomes in the 8 years that I have been talking to the government. I am saddened and frustrated that we are still having no solution. 2 years ago, I spoke in an estimate of the death of a man, Mr. Marika, was a 38-year-old Yolngu man. He was attending a funeral in homeland, which when he died, rather, and there was no emergency response. Family were on the phone, and eventually they said they would drive and meet the ambulance closer to Nhulunbuy, but it never arrived, and the man died on the way. In the past, MAF charter planes were retrieving patients who needed a stretcher and a bed, but there was nothing on board. One pilot told of a person with a broken pelvis who had to sit in a seat and travel to go. Following this, MAF have engineered a bed that is certified for patient travel, and this can be used when the health provider books a plane. But it's not available on call. To make this model work, we need this airplane to stand by with a pilot and an airplane on standby. At the moment, if this plane is needed, it may be out flying charter flights, and all pilots may also be booked to go on a charter flight. Into the future, we need to have an aircraft for the region, single-engine plane, or a helicopter, or both that based in Go to service across the entire region. Madam Speaker, we also need to see more programs on prevention and community education on health issues across our communities. Diabetes can be prevented by, but we need to clear up the programs on the kinds of issues to give people knowledge on how to create strong, healthy diets. Madam Speaker, I will take this opportunity to thank the health workers in our region, the Miwach Health, Gov Hospital staff, Allied Health, St. John staff, Lainapoy Health, Madakal Health, and the aged care health workers and the private healthcare workers in our region, as well as all the elders and community members that will practice and teach traditional healthcare. Health issues in our region are very complex. We have many people with health issues and many wonderful healthcare workers who do their best to look after the people of Mulka electorate. But we do need resources for our homeland towns, investment, and here will bring a better future. Thank you, Madam Speaker.
Member for Karama.
Thank you, Madam Speaker. And before I start, I would also the Grant Tamling. I think he was a fantastic champion of the territory, and if we can follow in those footsteps, we'll be doing very well. But let me now go back to the matter of public importance. And the title was that the NT government ensures its investment in healthcare meets current and projected future needs of all Territorians. Well, Madam Speaker, I think I speak on behalf of the whole Assembly, when I think we have a number of things in common here. I believe we all want to have a first-class health system to serve all Territorians. I believe we all want to have well-staffed hospitals and healthcare facilities. I believe we would all want the Territory to be a place where health professionals want to come here to work and live rather than leave. And I believe we would all want to have short waiting times, and noting that my son's a paramedic, reduce the need for ramping services to support our health service. So I think we all have the same aspiration. Unfortunately, this is not the system we inherited when we came to government. We actually inherited a broken system, and I think the Minister for Health alluded to many of those issues. But let me go back. And as members wouldn't be surprised, and I'm sure the opposition's not surprised, I take them back to our plan here, because we said we were going to restore our lifestyle. And part of that was access to health care when you need it. Access to health care when you need it, because we can't get it. And there are a couple of elements to this plan, and I'll just touch on them, and others have already spoken in detail, including the Minister for Health. We will fix the broken hospital system. We will stop Labor's endless code yellows by relieving the pressure on hospital emergency departments. We will tackle alcohol-related harm that is increasingly rising in emergency wards with stronger laws and rehabilitation. And that includes laws against those who assault workers, including health workers. We will work with the federal government to increase aged care facilities to help free up hospital beds. And I'm sure as part of all the federal elections coming up, our government will be making representation to our federal counterparts. This will also improve the wait times for Territorians on much needed surgeries. Another element, better access to cheaper medicines. Families will get easier access to cheaper medicines and vaccines, and we've seen what we've already done with meningococcal and others. This will save time and money for families and take pressure off GP waiting rooms. And then we have disability services, and I know the Minister is looking forward and working towards improving access to a greater range of disability services and additional needs schooling. So that was just what we went out publicly. We recognised that the system was broke. And I guess one of the things we really need to do is understand how can we fix it? How can we fix this broken system? And a key element of fixing the broken system is we've got to be able to fund it. Fund it. Because Labor made lots and lots of promises, but they didn't fund it. And that's just not right, Madam Speaker. It doesn't work that way. And we are definitely about trying to fund it. And how? We're going to rebuild our economy. Rebuild our economy, Madam Speaker. And how are we doing that? This is something that Labor never understood. You need to actually rebuild the economy to fund our essential services, be it health, be it education, be it police. We need to get the economy going, and that is what this government is focused on. So, when we look at some of the legislation we've just recently passed, it needs to be looked in that lens of building the economy. I know people say, oh, that coordinating the legislation, we shouldn't have done it. It was all focused on getting our economy going, making it easier for the economy to grow. Our payroll tax reform, it is there to support our private sector, to let them grow. We've just had the merit review go through. That is to take out the red tape, make sure that projects, sure there has to be the due diligence, there has to be the appropriate scrutiny, but not the overly bureaucratic third-party stuff coming in to delay projects that generally can get up and get their territory growing. And I can tell you, and I heard I think it was the member for Jinson the other day, almost sort of saying, oh, we don't really want the private sector, you know, you're too focused on the private sector. Well, I can tell you, I am an absolute champion of the private sector, and I have aspirations where they can actually really fund our budget, but we've got to let them do it. We can't hold them back. And that's where a lot of our initiatives at the moment are there to free it up so we can get our own source revenue going. We can get the gas industry going. We can get our onshore royalties going. I heard the member for Nightcliff saying, oh, Impex, you don't get the royalties. That is offshore. Those royalties go to the Commonwealth Government. They don't go to the Northern Territory Government. If only you'd understand these things. We've got to get our own revenue. So I just say again, I believe we all have the same aspiration. Unfortunately, Labor failed. They didn't deliver. We are committed to delivering, but we're going to do it in a funded way. We are fully committed. I'm really pleased to be the Assistant Minister for Health, and I absolutely support our government's initiative, and I do thank you for bringing on the MPI. Thank you.
Member for Johnston.
Thank you, Madam Speaker. I also welcome the opportunity to talk about health here in the Northern Territory and thank the Leader of the Opposition for bringing this important issue to the Chamber. And like the member for Mooka, I want to begin by thanking our incredibly hardworking and dedicated health workers, nurses, doctors, health workers, allied health professionals and everyone who works tirelessly to look after all the health needs of our communities. These professionals are the backbone of our healthcare system and their efforts are nothing short of heroic. In a roundabout way, health actually brought me here to the Northern Territory. I first came here 30 years ago to visit my brother, who'd come here as a young doctor, drawn like so many by the complex and acute health needs of our territory. And like so many people who've worked so hard for the health of the Northern Territory, he continues to have a connection here through Menzies. And through him, I gained an early insight into the health challenges that the Northern Territory faces, and what we're facing now is nothing new. We know that we face huge challenges addressing our unique social determinants of health here: access to housing, education, employment, social networks, healthcare, and wraparound social services. All of these are fundamental to improving health outcomes. And we must also acknowledge the cultural determinants of health across the Territory, which encompass the different ways that culture, traditions, values and practices influence the health and wellbeing of individuals and communities. So it's really important that when we talk about health spending, we're not just talking about physical health, we're also talking about addressing these social and cultural determinants of health. To make meaningful progress in improving health outcomes, it's essential that we invest in upstream public health measures, in addition to the traditional primary and emergency healthcare services, which are so vital for the health of our current society. These upstream measures address the root causes of health issues, targeting the social, economic and environmental factors that contribute to poor health outcomes. Long-term generational investment in these initiatives can help reorient our health services towards more localised preventative health models. These models serve to improve overall health, prevent future health issues and reduce disparities, and ultimately lead to stronger, healthier communities. These are the critical elements of overall well-being. And as the member for Daly mentioned, we must also recognise the importance of working in partnership with local communities to develop appropriate healthcare solutions. We know that local communities have invaluable knowledge of their own needs, traditions and challenges, and involving them in the development and delivery of health service ensures that these services are culturally appropriate, accessible, and that they're going to work. Collaborating with local communities will help us tailor healthcare services to their specific needs and ensure better health outcomes for all of us in the long term. In my electorate, like so many of us, I see firsthand how many people struggle with accessing appropriate and timely health services and care. This is not just a local issue, it's a territory-wide challenge that does demand our immediate attention. The broader health needs of the NT are significant and urgent. Access to quality healthcare in remote and regional communities remains one of the Territory's most pressing issues. In fact, remote communities in the NT experience some of the worst health outcomes in the country. Life expectancy in remote areas is on average 11 years lower than in urban areas, with Aboriginal Territorians living 9.5 years less than non-Aboriginal Territorians. Over 30% of the Territory's population live in remote or very remote areas where healthcare services are scarce and access to primary healthcare is severely limited. And we heard about this from the member for Mulka. Residents in these areas often must travel hundreds of kilometres to access basic healthcare services, leading to delayed treatment, preventable hospitalisations and significantly poorer health outcomes. Emergency evacuations, which don't always go right, as we heard, due to inadequate local healthcare services, are an ongoing reality. For mental health crises, a lack of immediate local support can lead to emergency department visits, unnecessary hospital admissions, and exacerbate an already stretched system. Mental health services here in the Territory are in particular under-resourced. Over 25% of Territorians report experiencing high or very high levels of psychological distress, compared to the national average of 13.5%. Without early intervention and community-based mental health services, individuals often reach crisis point, overwhelming emergency departments and hospital services. Early intervention across our whole health system saves lives, reduces pressure on hospitals, and ultimately saves the government significant resources. Funding must be targeted at supporting people before health reaches a crisis point, and we need to ensure that people receive timely care closer to home. As I said, in my electorate, I hear from residents every day who are unable to access healthcare when they need it most. And I just want to say again, I want to recognise the amazing work that our healthcare system does. I've been a very lucky recipient of incredible healthcare here in the Northern Territory in our public health system over, unfortunately, a myriad of health issues, and it's been incredible. The service that I have got has been amazing, and my family, and I just want to note that again. But we know that many people are unable to access healthcare when they need it most, whether it's really long wait times where the average wait for a specialist appointment exceeds 12 weeks, the lack of culturally appropriate services, the desperate shortage of healthcare professionals and the pressure that puts our healthcare professionals under. All these barriers are real and they're affecting people's lives every day. And the broader health landscape in the Northern Territory is equally concerning. Chronic diseases like diabetes, cardiovascular disease and respiratory conditions are more prevalent here than anywhere else in Australia. For example, the rate of diabetes in the NT is over 2.5 times the national average. Aboriginal Territorians are 4 times more likely to be hospitalised for diabetes-related complications. Aged care services are also under immense pressure, and we know that many beds in our hospital are currently taken up by people who actually need to be in appropriate aged healthcare services. The social services and wellbeing sector is the largest employer in the Northern Territory, and supporting this sector through targeted funding will enhance care quality and reduce stigma around health issues. We must prioritise health support for Aboriginal communities. Closing the gap in health outcomes is not just a policy goal, it's a social justice imperative. We heard from the Productivity Commission 2 weeks ago that the Northern Territory is going backwards against 8 of the closing the gap targets, including female life expectancy and birth weight. Aboriginal Territorians are 3.5 times more likely to experience avoidable hospital admissions and 2.5 times more likely to die from preventable causes than non-Aboriginal residents. Culturally appropriate services and support for Aboriginal health workers are essential components of any effective health strategy. And health is, of course, also closely linked to broader social issues such as housing, food, security, education and safety. Addressing these factors is critical to improving health outcomes. Policies that support safe, affordable housing, food security and healthy, violence-free relationships enable Territorians to manage their health more effectively and lead fulfilling lives. As we look at ways to improve health outcomes in the Northern Territory, we also must be acutely aware of the impact that industrial development can have on the health of our people, especially in our more vulnerable and remote communities. The risks posed by these industries are not abstract, they're very real and very immediate. As we continue to open up the Territory for business, and just to note, the member for Karama, I'm not opposed to private enterprise, I'm not opposed to building, I didn't say that, and I'm not opposed to building our economy. But I want to make sure that if we're opening up the Territory for business, we need to make sure that this business will not make us sicker. In 2023, Northern Territory paediatricians, hard-working practitioners who look after all of our children here in the Northern Territory, asked for research and evidence on the impact of oil and gas development on our health. They asked this because their pledge is to do no harm, and they were worried about the health impacts of this development on their patients. I remind this chamber that these specialists, these doctors, have pledged to do no harm, and their only agenda is to look after our sick children. I wonder if these are the people, the activists, that the CLP wants to leave the Northern Territory. The outcome of this research is clear. The risks of oil and gas development for human health, which I have here, anyone is welcome to look at it. A synthesis of evidence and implications for Australia shows us very clearly that extraction processes such as hydraulic fracking and drilling can have significant environmental and health aspects. These operations release harmful chemicals into the air, soil and water, all of which can directly affect public health. Studies have shown that exposure to these chemicals can lead to a range of health issues, respiratory problems, cardiovascular disease and neurological damage, to name a few. People living in proximity to these operations, including in areas like the Beetaloo Basin and around the Middle Arm Precinct in Darwin Harbour, are at increased risk. Our healthcare system, already stretched thin by the demands of chronic disease and mental health challenges, will face even greater burdens as these health impacts begin to manifest. And beyond the direct health risks, the environmental consequences of oil and gas extraction are also of great concern. Contamination of water sources, disruption of local ecosystems and the destruction of wildlife habitats could exacerbate the already significant pressures on our environment and on our communities. If our commitment is to continue to improve health outcomes in the Northern Territory, we must ensure that we're not trading one set of health risks for another. The Northern Territory cannot afford to ignore mounting evidence of these health risks. In closing, the health challenges we face in the Northern Territory are not insurmountable, but they require a united effort. We must continue to advocate for better healthcare services, chronic disease prevention, mental health services and programs that break the cycle of disadvantage. We must also protect our environment from industries that threaten to harm our land, air and water and the health of the people who call this place home. Let's make health our priority because our communities deserve nothing less. Thank you. And Mr Deputy Speaker, I seek leave to table this report.
Is leave granted?
Thank you.
Member Fong Lim.
Thank you, Mr Deputy Speaker. That the NT government ensures its investment in healthcare meets current and future projected needs of all Territorians. Now, that is indeed a matter of public importance, and I welcome the opposition raising it. But there is something of a perverse irony that the Labor opposition would raise it, noting their chronic lack of investment in the healthcare system over large tracts of time. Now, I can only imagine that they've raised it today serendipitously, hoping to capitalise on the federal election, federal budget, and announcements that may paper over their negligent conduct in this area. Because investment is about more than just buildings. Investment is also about people. And that is where the last 8 years of Labor governance was abysmal in this place. Now, I specifically want to talk to you about durable healthcare workforce, and I've raised it before in other forms, and I'm astonished, as I say, that this would be the item that the opposition would choose to draw attention to, because as the Minister for Health pointed out, we're working aggressively and at pace in this space to do all manner of things that they dropped the ball on over a long period of time. Now, I'm not ordinarily predisposed to playing kick the last lot for the last 8 years, but this really is taking the prize today. In the relentless pursuit for financial capital over the last 8 years, the Labor government dropped the ball on human capital, and I have raised this point before. And in the Treasurer's annual financial report and the TAFA that came out late last year, if you look carefully, you'll see that health is the government's largest sector, the government sector's largest expenditure category, and it's ideally illustrative of the Labor government's mismanagement. And the TAFA reiterates, as did the Minister for Health earlier, that there has been a, quote, increased expenditure in relation to hospital services, largely driven by skilled workforce shortages requiring an increased utilisation of high-cost agency labour hire and overtime. Now, why has that happened? Why is it that our system is bankrupting itself, having to rely on a two-tier system where we're paying differential rates and having to rely on agency workforce to keep the system from collapsing? It's because of poor economic policy choices that have been made over a period of time. And while I applaud the federal Labor government for kicking in from time to time in our healthcare arena, and likewise federal Liberal governments, there is very little that Territory Labor can really lay credit to over the last 8 years in that regard. We have facilities that are underserviced with inadequate workforce to be able to provide high-quality healthcare, and it is a disincentive now for people setting up shop in the Northern Territory and sticking around in the Northern Territory. And that's the point that the Minister for Health made, and we are working on these issues holistically. Yes, there is a component that is about buildings and plant and capital, but there is also a component that is about making this place livable, making it safe for healthcare workforce, and not just attracting them, but finding ways to retain them. I am really astonished in this regard. The quantum of that utilisation of high-cost agency labour hire and overtime was, quote unquote, health spending increased by $228 million from $2.02 billion in 2023-24 to $2.24 billion in 2023-24 as a result of increased expenditure in hospitals, largely driven by skilled workforce shortages, requiring increased utilisation of high-cost labour, agency labour hire and overtime. It's really astonishing that they would draw attention to this area of policy ineptitude. Successive Territory Labor Treasurers and successive Territory Labor Health Ministers have neglected this issue because, quite frankly, it was in the too hard basket. Not for this government. Not for this government. This is not in the too hard basket for this government. You will note that where they refuse to talk about population decline, we have tackled it from day one. And it is just the beginning in this regard, because at the moment, what are we doing? At the moment, we are trying to stimulate the residential construction sector, we're trying to stimulate housing supply, we're trying to incentivise small business to spend money. There's all of these things that are working in tandem, in concert, to try and create the preconditions for a place that people want to stick around in. Because right now, it's not just us that has a healthcare shortage. There is a global shortage of healthcare workers, as the Deputy Opposition Leader pointed out. And in order to be competitive in that marketplace, you have to provide a reasonable offering. And so we are trying very hard to set the preconditions to make it possible for people to want to come here, stay here, and succeed here. Because right now that is simply not the case. Now, I'm committed to working with the Minister for International Students, Migration and Population, and the Minister for Health on creating sustainable new workforce pipelines in healthcare. And why do I say new? I say new because we have had so many misstarts in this place, so many false alarms, so many red herrings and utopia-esque announcements that it's embarrassing. You can go back to September 2023 to find the last lot of pseudo-engagement done by the then Deputy Chief Minister on a mercy mission to India, to Kerala, to try and set up new workforce pipelines with nurses purportedly and create aviation sector options. Where are those nurses? What have we got to show for that MOU from Kerala? Seriously, what have we got to show for it? It is astonishing that you would bring this up. Of all things, I mean, I probably will give you a fairer hearing than anyone. Mr. Deputy Speaker, I will give the Labor opposition a fairer hearing than anyone in this place. And there are things they could point to that they've done successfully. Why not talk about them? No, in actual fact, perhaps they're being extremely brave in highlighting just how negligent they've been in the policy arena in relation to workforce development over such a long period of time. I mean, I'm not even inclined to speak on matters of public importance, but this one is actually so important that I could not speak on it. I'm committed, as I say, to working with the Minister for International Students, Migration and Population and the Minister for Health on creating sustainable new workforce pipelines. And where they have failed to do anything other than make utopia-esque announcements, we will actually deliver. Just because you can't see it doesn't mean there aren't things happening in the background in a whole range of areas. And yes, the headline-grabbing material is all about deregulating our environment, all about trying to create business confidence, and I'm the first to admit that it's an aggressive agenda that the government is pushing in that regard. But it's not the only part of the agenda that we're pushing. There is a threefold agenda to try and reduce crime, to try and rebuild the economy, and try to restore lifestyle. Now, under those, lots of different things are happening in every regard. And whether they all work perfectly or at the same time remains to be seen. But quite seriously, after years of negligence on workforce, population, talent acquisition, migration, higher education, what has the former government got to stand on in this regard? Well, they really have dropped the ball entirely on the Labor, again spelt the right way, Labor component of the Labor equation. Seriously, to be this fixated over this period of time on major projects and infrastructure and, it astonishes me. The fact is that the underlying problem here is demographic decline, and I've spoken about this at length, so I'm not going to go through it again. But the key thing to remember here is that demographic decline has workforce implications. Good luck servicing any industry if you don't have people, and that's why we're working on trying to bring those people here and trying to create the preconditions for people to want to come here, stay here, live here, work here. And healthcare workforce are a really important part of that equation. Now, our demographic decline has undermined, not fostered economic development, and it's had an attendant impact on the quality of life for all Territorians, and it's diminished it, not improved it. And demographic decline is at the root. It is at the root of the workforce crisis in healthcare. And be clear, that's exactly what it is, a workforce crisis in healthcare. Now, I want to be very careful about what I say here, because I know the people that work in our healthcare system are working to their, as hard as they possibly can to provide the best quality of care that they possibly can. But they are working with the policy odds stacked against them, and they have been for a number of years now. And it is serendipitous that just yesterday, one of my constituents, a gentleman I know named Simon Grumbauer, wrote a letter in desperation to the NT Independent. And I want to highlight this letter today because it speaks volumes about the situation we're in right now. The letter is entitled "Stroke Victim Left in Limbo at RDH with No Rehab Services." Now, I've been trying to help Simon Grumbauer to the best of my ability because his wife Elva recently had a stroke and she's received care at RDH and she's been redirected to palliative care. And it's Simon's contention that she should have the option for rehabilitative care. Now, I know that the people that work in RDH are doing their darndest to provide the best possible service they can, but the contention made by my constituent is this, quote unquote, "It seems that RDH does not have the expertise or staff to deal with any but the mildest form of stroke and therefore send the rest of us to die regardless of age." Now, that's a harsh charge, but what I will say is this: RDH doesn't have facilities for mechanical thrombectomy. RDH doesn't have specialist stroke physicians. RDH has limited neurologists, and those that are there work overtime and flat out to try and keep up with the demand. And they are not to be pilloried for their service, they are to be lauded for their service. But the people who are to be pilloried for their negligence are the former government, who didn't do anything to incentivise those specialists coming and staying in the Northern Territory, who didn't have transitional mechanisms in place to fill the gaps when we lost critical specialists and weren't able to get people to fill that gap. I feel for Simon because there's very little that I can do for him or for his wife Elva at this point, short of advocate for him and his wife to be able to get access to the rehabilitative care that they are seeking at Palmerston Hospital. And that's a medical decision, and that will be made by the medical specialists. But, you know, stroke is a perfect illustration of something where you require people with high-end skills, and you require them not after the fact, but at the time of the incidents and the onset of the occasion. I really do struggle to see why, you know, we would be discussing this today, except, as I say, because it's worth shining a light on, and perhaps that's what we take from today. But I think when all is said and done, you know, Labor's commitment to facing the NT's economic reality, which is a quagmire of catastrophe made of their own creation, is something that we're just starting to have to accept. Our government will make lots of noises about negligent conduct, economic mismanagement going forth. But people's lives are at stake here. They're at stake in the bush, they're at stake in urban areas. This really does matter. You know, all browbeating aside, all of us want for a better, stronger, robust healthcare system. I grew up in this place at a time when investment in public health, public housing, public education and public infrastructure was sufficiently strong that we provided the preconditions for people to succeed. And successive governments over a number of years now have dropped the ball, and that process really accelerated over the last 8 years when we stopped paying attention to sustainable demographic growth to underpin sustainable economic growth. Now, I make the case frequently on the government side with my colleagues that it's great that you've got these industries that you want to concentrate on, but we're going to need people to fill all of them. And that's what we're trying to do. We're trying to make this place a place where people across those sectors will want to reside here, live here, work here and enduringly stay here, but also people in critical areas like healthcare will want to do the same. When you're talking about investment, remember, investment isn't just about plant and capital and bricks and mortar. It's not just about buildings and hospitals. It's not just about bricks and mortar. It's about people. And I share, you know, we all share concern for the state of our healthcare system. And so again, it's one of these things where I think we need to band together now and face the reality of the situation so that we can move forward constructively. Because unless and until we do accept that we have a population and workforce problem, unless we can find some sort of bipartisan consensus on moving forward on that agenda, for accepting that both sides dropped the ball on this over a number of years, and now we need to figure out how to not just attract, but retain and develop populations, the Northern Territory is going to be at a crossroads. Our economic development is not the only thing that's at stake here. It's our existence and our capacity to exist rather than just subsist within this jurisdiction. We cannot continue to joke about when in pain, get on a plane. You know, those days are done now. We know that there are critical issues in the healthcare sector and it is time for us to face them head on. And I commend the Minister for Health for facing those challenges and investing in our system appropriately going into the future. Thank you very much, Mr Deputy Speaker.
Thank you, Member Fong Lim. Any other speakers? Member Ferreira.
Thank you, Mr Deputy Speaker. I rise today to speak on a matter of vital importance for all Territorians. Ensuring our healthcare investment meets both the current and future needs of our communities, no matter where they are in the Territory. Health isn't just another policy area, it is central to positive outcomes, particularly out bush. Good health is the foundation for good families, happy communities, economic productivity, and indeed the Territory's collective future. Mr. Deputy Speaker, because of this, it's vital that the Northern Territory Government commits to not just to maintaining but also enhancing its investment in healthcare infrastructure, staffing and servicing. Our healthcare system should be responsive, accessible and reliable, now and always. It's what people that sent us here expect of us. Friends, when I speak about health, I speak on behalf of my constituents in 𝘓𝘗𝘰𝘃𝘓𝘓. They know all too well what happens when governments don't invest, when clinics go understaffed, when dialysis units are too far from home, and when family wait weeks for appointments or fly hundreds of kilometres for basic care. In places like 𝘥𝘦𝘧𝘦𝘠𝘓𝘓𝘠𝘓𝘓𝘓𝘠𝑚𝑛𝑔𝑟𝑒𝑒𝑑𝑎, Mackay Wurrumyanga. Healthcare isn't just always a short drive. It's often a long journey, sometimes with difficulty and delay. Health out bush is vital. The former government understood this reality, which is why we prioritise health. Since 2016, the former Labor government delivered significant reform and investments in remote health, including transition health services to Aboriginal community control in places like Mackay, Docker River, Yulara and West Arnhem, and supporting the establishment of Red Lily Health Board. This transition empowers local communities to take lead in their own healthcare, reflecting the principle of local decision-making. The Labor government delivered new health centres in Gulawinku, Nuka, Numbulwa, Robertson River and Upper Kamba. The primary care pilots in Mackay, Guyula and Tiwi Islands are strengthening care pathways and easing the pressure on emergency departments. We invested in staffing and local workforce initiative, launching paramedic and nurse practitioner trials, expanding telehealth services, and progressing the remote workforce action plan in partnership with AMSANT, NTPHN and the Australian government. New training pathways and programs which help grow and retain our local health workforce. We also prioritise community safety for health workers. To protect those on the front line, we implemented security upgrades to staff housing, provisional of personal safety devices and personal partnership with police and private security firms. Significantly for my constituents, we also worked on a new clinic in 𝘓𝘓𝘓𝘓𝘓, a federally funded project secured under Labor, designed in partnership with the community, which is still sitting under limbo, so I'll be asking the CLP about it sooner. Our community is still waiting for delivery of its medical clinic, a project already budgeted and with federal funding but inexplicitly delayed. The community needs and deserves answers. Delays in vital projects such as these have real human costs. People should not be forced to travel hundreds of kilometres to access basic medical care. And I've stated this before, when an elder comes into town for medical assistance, they bring the whole tribe. This situation places undue pressure, not only on families, but also on our urban centres, contributing to issues such as overcrowded housing and increased rough sleeping. We just need to look at some of our parks. That delay is not just an administrative oversight, it's a betrayal, and the people of 𝘓𝘓𝘓𝘓𝘓𝘓𝘓𝘓𝘓 deserve better. If the CLP is looking to balance budget by cutting crucial health projects in the bush, they should come out and say so. The people of 𝘓𝘓𝘓𝘓𝘓 are urgently calling on the government to complete this project. They deserve to see action. The resources have been allocated and the funds provided. Deputy Speaker, the health system is powered by a fantastic health staff, and the government needs to invest in our health care workers, especially out in remote communities. Health staff, from doctors and nurses to allied health professional administrative workers, are the backbone of our health system. They deserve our full support. Investment must include robust recruitment and retention strategies, better incentives, and support work environments that respect and value these individuals' enormous contributions to our community. It is the same situation out bush as it is in town. We must also look to future needs. Our population is growing and aging, and chronic illnesses, including diabetes and kidney disease, are alarming in our remote communities. Investments such as renal clinics and new health centres like the one recently established in Dheran must continue. Finally, I acknowledge the support from our Labor colleagues in Canberra who have consistently prioritised healthcare. Their initiatives included GP emergency Medicare clinics and strengthening bulk bill initiatives, reflecting a strong commitment to rebuilding and revitalising healthcare nationwide. It is essential that the Territory Government matches the commitment and ensures all Territorians are included and not some left behind. I acknowledge that vital support from our federal Labor colleagues who consistently prioritise healthcare. Federal Labor and our Territory representative have delivered the largest ever Medicare investment, $8.5 billion, to ensure GP visits are free for most Australians by 2030. They've also established 50 Medicare urgent care clinics nationwide, including successful clinics in Palmerston and soon Darwin, offering bulk billed extensive hour services and ease pressure on our hospitals. They're tripling bulk billing incentives, doubling GP training placements in the NT and with Charles Darwin University, and delivering cheaper medicines to restore faith in our healthcare system. Mr. Deputy Speaker, the health of our community cannot afford to be compromised by political games and bureaucratical delays. Territorians, no matter where they live in the Territory, deserve and expect immediate and sustained action. This Parliament knows too well the healthcare challenges facing Territorians. It's time we're committed to ensuring our healthcare system meets and exceeds these challenges today and for generations to come. Thank you.
Thank you. Member for Sanderson.
Mr. Deputy Speaker, thank you for this opportunity to speak on the matter of public importance raised today. That the NT government ensures its investment in healthcare meets current and projected future needs of all Territorians. This is indeed a critical matter, as healthcare is fundamental to the well-being of our community. As a member for Sanderson and part of the current CLP government, I wholeheartedly agree with the importance of ensuring quality and future-proof healthcare investment. However, Mr. Deputy Speaker, it is important to critically assess how effectively previous investments have translated into better outcomes for Territorians. We must look closely at the past to clearly understand the challenges and define our path forward. The previous Labor government from 2016 to August 2024, while significantly increasing healthcare staffing levels, failed to match this growth with a corresponding enhancement in service quality or outcomes. The budget documents clearly reflect this disparity. Full-time equivalent numbers increased, yet quality indicators and patient experiences deteriorated. The healthcare sector is home to many dedicated professionals who are committed to delivering the highest standard of care to the people of the Northern Territory. However, the reckless and misguided expenditure of the past 8 years under Labor is only now drawing alarm for the opposition. Let's consider the facts. In reviewing the health budget papers from 2016-17 to the most recent 2024-25 agency budget statement, We observe significant growth in healthcare expenditure. Yet, despite such increased investment, the system under Labour continued to suffer, which in turn can lead to degradation in service quality. Firstly, Mr. Deputy Speaker, hospital wait times have escalated dramatically. Patients across the Northern Territory were waiting longer for critical procedures and treatments, even though the population numbers have remained relatively stable. For example, waiting times for elective surgeries and emergency department treatments have seen substantial increases year on year, putting undue stress on patients and their families. Additionally, Mr. Deputy Speaker, I facilitated a meeting yesterday between representatives from the Ministerial Advisory Committee for the Seniors and Minister Edgington. Their number one concern was the critical shortage of aged care beds, which has directly led to numerous elderly Territorians occupying hospital beds instead. This situation starkly highlights the former government's lack of action and foresight, causing many senior Territorians who spend their lives working hard and contributing taxes to spend their final days in hospital beds rather than in the dignity and comfort of appropriate aged care facilities. The previous Labour government members might attempt to justify these deteriorations, citing COVID-19 as a contributing factor. However, it is important to highlight that the impact of COVID-19 in the Northern Territory was negligible compared to other regions of Australia. It cannot explain the consistent degradation we witnessed over multiple years. Moreover, Mr. Deputy Speaker, the previous Labour government's era was marked by a significant expansion of administrative overheads. The growth in healthcare FTEs predominantly occurred in the administrative roles, rather than frontline health professionals who directly improve patient outcomes. Increased bureaucracy has not translated into better care. Instead, it created layers of inefficiency, diluting the impact of every healthcare dollar spent. When considering the evidence of patient feedback, staffing distribution, and quality performance metrics detailed in successive budget papers, despite higher spending, key performance indicators such as patient satisfaction and timely care delivery have worsened. The previous Labour government allowed inefficiencies to grow unchecked, disregarding practical outcomes for Territorians. I heard the member for Daly speak highly of the previous government's support for staff. But let's be honest, the reality tells a very different story. One of the most damaging decisions made by the former Gunner government was the introduction of a public sector pay freeze. They called it responsible budgeting, but in truth, it was a blow to the very heart of our health system. The people most affected by this was our hardworking social workers, psychologists, occupational therapists, pharmacists, speech pathologists, dietitians, Aboriginal liaison officers, hospital support workers, and frontline admin staff members who form the backbone of our hospitals and health services. These are the people who show up every single day, often under immense pressure, to care for our community, and instead of being rewarded or recognized, they were told to do more with less. This isn't just about wages. It's about the respect, retention, and recognition. And the consequences have been devastating. The pay freeze led to staff morale plummeting and contributed significantly to the workforce shortages and burnout we are now grappling with across the Northern Territory. During the previous Labour government, the crime was skyrocketing. Alcohol-related presentations were on the rise, and our hospital and clinic staff were bearing the brunt of it all. Health workers who dedicate their lives to caring for others were becoming the punching bags of antisocial and intoxicated individuals under the influence of alcohol and other drugs. The level of abuse endured by our frontline health staff during this time was nothing short of appalling. Verbal threats, physical assaults, and constant fear became part of their daily working environment. These are not just statistics. These are real people doing vital work who were left exposed and unsupported. The government of the day failed to protect those who were protecting us. Their inaction allowed this culture of violence and disrespect to take root in our health system, and the damage it's caused to staff well-being, to morale, and to retention has been immense. So when we hear praise for the previous government's support for staff, we need to call it what it is, empty rhetoric. They said one thing but did the opposite, and our health system is still paying the price. Our government now faces the task of recalibrating this imbalance. Minister Edgington's priority is clear. Investment in healthcare must be strategic, accountable, and outcome-focused. The CLP government will rigorously ensure each dollar allocated to healthcare achieves measurable improvement in health outcomes for Territorians. Mr. Deputy Speaker, while the Labour opposition raises this matter of public importance, it is their record that demands scrutiny. Territorians deserve better than higher costs for deteriorating services. Our CLP government is committed to restoring efficiency, quality, and accountability in healthcare investment to meet both current and future needs effectively and sustainably. Thank you, Mr. Deputy Speaker.
Thank you, Member for Jinson. Leader of the Opposition.
Thank you, Mr. Deputy Speaker, and I rise to speak on this very important matter of public importance which affects all Territorians, and that is health. Mr. Deputy Speaker, our Territory Labor opposition has brought forward this matter of public importance because we are deeply concerned that the current CLP government is following in the footsteps of their predecessors, the previous CLP governments, which neglected our Northern Territory health systems. Mr. Deputy Speaker, right now we have a health minister who refuses to talk about our hospitals, who refuses to talk about our maternity wards, who refuses to talk about access to essential health services right across the Northern Territory, and refuses to talk about our health workforce capacity. Mr. Deputy Speaker, Territorians will remember under the previous CLP governments, Territorians suffered greatly due to the lack of planning from both current and future demands on our health system. Health services were delivered without evidence-based strategies, and they failed to produce real outcomes for Territorians when it comes to improving health. Mr. Deputy Speaker, former CLP governments neglected hospital capacity, they neglected renal services in both urban and remote areas. They neglected essential hospital amenities and infrastructure for remote primary health care centres right across the Northern Territory. Mr. Deputy Speaker, 7 months in and we have not heard any vision from the CLP government or the Health Minister about what they plan to do in this literally life-saving space. Sadly, we feel that we are seeing a repeat of history and not for the better when we look at the current and new CLP government. Between 2012 and 2016, the CLP had 5 different health ministers, so no wonder there was no long-term health vision in that chaotic 4 years. Despite promising a PET scanner over 3 federal election cycles, the CLP failed to deliver this for Territorians. It was the Territory Labor government, Mr. Deputy Speaker, that secured the federal funding, committed the Northern Territory resources and delivered the PET scanner and the cyclotron here in the Northern Territory. And it is the federal Labor government that continues to invest, Mr. Deputy Speaker, in our health system and the well-being of Territorians. When we look at initiatives such as the Medicare urgent care clinics, providing bulk billed health care when now families in the Territory need it, cheaper medicines, reducing prescription costs for Territorians, record Medicare investment, the largest single boost to bulk billing in Australian history. Mr. Deputy Speaker, this is in contrast for when Peter Dutton was the Coalition's health minister. He gutted our healthcare system. Peter Dutton tried to dismantle bulk billing by forcing patients to see a tax when they went to see a general practitioner. Mr. Deputy Speaker, Peter Dutton cut $50 billion from our public hospitals across Australia. He was voted the worst health minister in Medicare's history by Australian doctors, the experts in the field. And Peter Dutton imposed a 6-year Medicare rebate freeze, forcing doctors to raise fees and to cut bulk billing services for many Australians. Mr. Deputy Speaker, we cannot afford to let the health of Territorians, whether it be in our urban, regional or remote areas across the Northern Territory, suffer due to budget constraints. Mr Deputy Speaker, there is nothing more important than your health. That is why in Budget 2024, the former Labor government delivered a record $2.2 billion health budget. This investment included $32 million for new healthcare facilities to ease hospital pressures, the planning and early works for new aged care facility in Palmerston and the new healthcare centre in Borroloola. $10 million to service land at the Palmerston Regional Health Precinct for a $120 bed aged care facility and $2 million for its very detailed design. Mr Deputy Speaker, we know that increased numbers of suitable aged care beds will reduce the emergency department pressures and hospital bed pressures when we know, Mr Deputy Speaker, that the number of Territorians over 65 years of age is projected to increase to 35,000 Territorians by 2041. Mr Deputy Speaker, the new $20 million Borroloola Health Clinic will transform primary health care delivered across the Roper Gulf region in the Health Minister's own electorate of Barkly, providing better health care closer to home and more access for those living in that region. Yet we've heard nothing publicly from the Health Minister, the member for Barkly, Steve Edgington, about this critical health project. You would think, Mr Deputy Speaker, that a project of this significance would be, which is literally going to change lives of thousands of Territorians in that part of the territory, would be spruiked, no matter what side of politics that you come from. Mr Deputy Speaker, the new Borroloola Health Centre will offer consulting rooms, emergency bays, dental services, x-ray facilities, a hearing booth and renal services, and a morgue. Mr Deputy Speaker, we heard from the member for Arafura talking about renal services. And last year, I was honoured to be the Health Minister to release the Northern Territory's new renal strategy, 2024 to 2029. There includes a workforce component for community kidney workers in that new strategy, Mr Deputy Speaker. I myself have written to the Health Minister and not yet received any response or reply. I think I wrote several weeks ago now around the update on this game-changing part of the strategy, where we talk about local community members in our remote communities being trained to become kidney health workers and be able to support more community members staying in their community on country to receive life-saving renal care. I will wait that update, Mr Deputy Speaker. When it comes to primary health care infrastructure, which reduces hospital pressures, we want to see the attraction and the retention of our amazing healthcare professionals in the Northern Territory. That is government as well as non-government, Mr Deputy Speaker. So as part of the last Territory budget in 2024, our former Labor government also boosted the health operating budget, an extra $200 million in 2023 to 24 and an extra $100 million in 24-25. These additional investments ensured that resources were going to where they needed most, so that Territorians, no matter where they lived, Mr Deputy Speaker, can access quality care they deserve. The system's not perfect, but we all have to work together to make sure it is always improved. And when we hear about the CLP's mantra of blowout costs in health, I want the CLP to be upfront, Mr Deputy Speaker, and tell Territorians about what healthcare services that they will cut, which clinics they intend to close to save $1, and what healthcare professionals they will sack to see this budget lowered. Mr Deputy Speaker, they are not being genuine in many things in this place, and they certainly need to be genuine when it comes to Territorians' health. We know that Territorians deserve to have the best healthcare possible, regardless of where they are, Mr Deputy Speaker, and I see you agreeing there. And this is not just about a policy issue, it's about the quality of life. It's about the dignity and well-being of Territorians who we all serve in this place. Every dollar we invest in healthcare services, Mr Deputy Speaker, saves lives, prevents suffering and strengthens the health and well-being of our communities across the Northern Territory. When the Territory invests in health services, it ensures that all Territorians receive stronger hospitals that meet their growing demand, better access to doctors and specialists, especially in regional and remote areas, improved maternity services so that families get the best start in life, more aged care facilities, as we've heard from many speakers already this evening, in keeping our elderly Territorians safe and well cared for, more mental health support and wellbeing for those who need it the most, and in ways that are appropriate for them to be able to receive those services. Mr Deputy Speaker, we cannot afford short-term thinking when it comes to healthcare of Territorians. A failure to invest in our Territory health system today will cost us more money in the future, Mr Deputy Speaker. It'll cost higher dollars in hospital admissions. It will see a worsening health outcome overall for Territorians when we look at the numbers of people who have diseases and chronic diseases and preventable diseases. It will also create a further pressure system where we will see eventually it buckle. Mr Deputy Speaker, when we go to the National Close the Gap statement and strategy, the refresh strategy and the targets, last week we did not hear a single word from the CLP government. We did not hear a single word from the Health Minister, the member for Barkly, who is also the Minister for Aboriginal Affairs. The National Close the Gap strategy, Mr Deputy Speaker, is extremely important when it comes to reflecting the needs and the aspirations of Aboriginal and Torres Strait Islander Territorians. 1/3 of the Territory's population, may I remind the House, Mr Deputy Speaker. Not a single whisper, not a single comment or sentence, not one of the many press releases that the CLP have become quite fond of doing and releasing and not necessarily creating action that is going to be impactful. Not a single thought by the CLP government, by the Health Minister, Steve Edgington, who is also the Aboriginal Affairs Minister of the Northern Territory, around a response on behalf of the Northern Territory about the National Close the Gap strategy. Absolutely appalling. Mr Deputy Speaker, when we talk about life expectancy, it's easy to find the stats, but what we must remember, the numbers also have stories of Territorians and Australians attached to it. When we look at the life expectancy comparison, Mr Deputy Speaker, and we talk about closing the gap, this is one of the most stark contrasts that you will see when it comes to the National Close the Gap strategy. The life expectancy of Aboriginal and Torres Strait Islander females is 75.6 years, compared to non-Aboriginal and Torres Strait Islander females at 83.8 years. That gap, Mr Deputy Speaker, is 8.1 years different. The life expectancy of Aboriginal and Torres Strait Islander males is 71.9 years. Compare that to non-Aboriginal and Torres Strait Islander males, it's 80.6 years. That gap is 8.8 years, Mr Deputy Speaker. Mr Deputy Speaker, today I turn 40 and I am already halfway through my lowered life expectancy as an Aboriginal woman here in Australia. What a sad, sad statistic that is, to know that I am now middle-aged when it comes to my race and my gender, living in the luckiest country in the world. How hard it is to think about the people that we love, the people that we represent in this place, that purely because of your life expectancy, based on your attributes, based on your gender, that you are going to live less purely because of who you are, how you're born, and your background and your gender, Mr Deputy Speaker. We want to ensure, and we will work with the CLP government on those key initiatives when it comes to health, on those key initiatives when it comes to improving the life expectancy of remote Aboriginal Territorians and urban Aboriginal Territorians when it comes to that National Close the Gap strategy. And we offer our support, Mr Deputy Speaker, from the Territory Labor opposition to go past politics, to play past that cycle and to make sure that all of us in this place are contributing. I thought the Minister for Health would use this opportunity, his time in this very important matter, very important debate, the matter of public importance, to outline his vision. but he absolutely wasted his opportunity. We'd given it on almost like a silver platter, Mr Deputy Speaker, to speak about the vision of the Territory when it comes to health by the Health Minister, by the Aboriginal Affairs Minister, the Member for Barkly, Steve Edgington. All he did was rubbish former things from Labor and rubbish. No vision, no vision. Maybe they're not allowed to have a vision if they're not the Chief Minister over there. Maybe they're not allowed to speak out about the great things they want to see in the Territory and the great things they want to continue and the areas of improvement they would like the opposition to support in. Because guess what, Mr Deputy Speaker? We are 4 members representing 4 remote electorates, representing some of the most challenging and complex regions in the Northern Territory when it comes to health. But we also come with experience, we also come with great ideas, we also come with solid networks across our 4 electorates in our capacity as the Labor opposition to be able to contribute, to be able to do it in a genuine partnership way. So I offer my hand to the Minister for Health and Aboriginal Affairs and his CLP government if they are so interested in working together to close the gap. So this time next year, this time the year after, this time the year after that, and prior to the next 4-year election cycle in the Northern Territory, we can say we made a difference here in this place to support the advancement of healthcare for all Territorians. Thank you, Mr Deputy Speaker.
Thank you, Leader of the Opposition. Member for 𝘠𝘓𝘬.
𝘠𝘓𝘬𝘰𝘳 or 𝘠𝘓𝘬𝘳?
𝘠𝘓𝘬𝘳, sorry.
Mr Deputy Speaker, I rise today to contribute to this matter of public importance on the investment in the health sector in the Northern Territory. And Mr Deputy Speaker, it breaks my heart, straight from the Leader of the Opposition's mouth. They represent 4 of the most marginal electorates in the country with terrible, terrible health outcomes, and all 4 of them, Mr Deputy Speaker, who are now sitting in opposition alone, they represented these seats under a Labor government. And Mr Deputy Speaker, I apologise for misgendering you, they for 4 years, for 8 years, for 2 years or 3 years, if I remember that correctly, they sat in power, in government, and they did not deliver for their own constituents. And Mr Deputy Speaker, I can't understand how we've had a Labor government for 19 of the last 23 years and they're going to get up and say that the CLP government 8 months in isn't doing enough to close the gap. Mr Deputy Speaker, 19 of the last 23 years, and it breaks my heart that they're now going to get up and spout federal politics. They're going to say, how great is Anthony Albanese for his $150 power cuts and his slightly cheaper Medicare rebates, while he's doing absolutely nothing to help the poor health outcomes we have in the Territory. And Mr Deputy Speaker, I hear it when I talk to the member for Daly's constituents. They reach out to me and they say, what are we doing about Dundee? What are we doing about health services out towards the Daly? And it breaks my heart to know that he was in government. He was the Speaker at one point, Mr Deputy Speaker, and yet he could not achieve anything for his electorate. The member for Arnhem, the opposition leader now, she was a senior minister under Michael Gunner and Natasha Files and Eva Lawler. And what did she achieve health outcomes for her electorate? It honestly astounds me that they will come into this place tonight and go, the CLP government after 8 months has no vision for health. Yet, Mr Deputy Speaker, they're interjecting now because they don't like to hear the truth. They failed their own constituents, Mr Deputy Speaker. We're going to get up and we're going to talk life expectancies.
Order. Let the member for 𝘠𝘓𝘬 be heard in silence, please.
19 of the last 20.
Sorry.
I believe the time is now expired.
No, there's still time.
The clock never started for my speaking. Top left, 2 minutes
2:27
23.
on the global time. 2 minutes 23. Yeah.
I appreciate the member for Arnhem, the opposition leader's attention to detail, but I just wish she paid some of that attention to the constituents in her electorate who she could have improved the lives for, Mr Deputy Speaker. She could have genuinely made a difference in this place, and it's terrible.
Leader of the Opposition,
Mr Deputy Speaker, I am passionate about...
Order. Yes, can we cease the interjection? Let the member for 𝘠𝘓𝘬 be heard in silence. Everyone else was heard in silence. Thank you.
Mr Deputy Speaker, if the Leader of the Opposition had done some research, you'd know I'm quite passionate, especially around the Tiwi Islands, and I'm quite passionate what's happening out towards the Daly River, what's happening out at 𝘥𝘦𝘧𝘦. I want to make the Territory a better place, Mr Deputy Speaker, and I understand the best way to long-term look at reducing crime in the Northern Territory is to make sure we do invest in our communities, Mr Deputy Speaker. If we can turn it around, we can make them great places to live, we'll have a lot less transient population and a lot less issues. But right now, Mr Deputy Speaker, after 19 of the last 23 years, they're going to get up and say in 7 months we haven't done enough to close the gap. What did you achieve in 19 of the last 23 years? 8 years as a senior minister under 3 chief ministers, and yet they had the audacity to come in here today and say the CLP is all about cuts and the CLP is going to do this. Why didn't you invest? You spent billions of dollars you didn't have. Why didn't you put it into health? Why? I don't understand how we got here today, where all of a sudden they're going to rewrite history. They've got some federal talking points from Anthony Albanese, and they attack Peter Dutton in their speech, Mr Deputy Speaker. Their priorities are completely and utterly wrong, and if they had spent any of their time in this chamber and in the meetings and in the cabinet looking after their constituents, they wouldn't be here tonight saying, oh, poor us, poor us. Why didn't you invest? I can't understand. I don't understand. Why would you fail your own constituents? They're the people who voted for you, or at least the 30% of them that vote. But why on earth can you look yourself in the mirror tonight and think, I did a good job, I raised an important matter, though I failed them for 8 years?
Time. Thank you. Okay, so the global time has now expired. Minister?
Thank you, Mr Acting Deputy Speaker. I move that the House do now adjourn.
Question.